Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Venous thromboembolism, and we're looking at its risk factors. So here the risk factors, it includes of thromboembolism, that is it includes the pulmonary embolism as well as the DVT. So the risk factors of this, it is as follows, that is in terms of the major trauma. So in terms of the major trauma and like the spinal cord, so major trauma like that of the spinal cord. So the spinal cord injury or the fracture of the lower limb or the fracture, and this is of the LL, that is a lower limb. Next is the surgery like hip. So there is surgery. This is of the hip or the knee replacement. Hip or the knee replacement. Then there is a hospitalization. The hospitalization is for the heart failure. It's for the HF, that is a heart failure, or the atrial fibrillation, that is AF, or flutter, or the presence of flutter, and this is within last 3 months. So it is within last 3 months. Then comes the MI, that is a myocardial infarction. This is within 3 months, so it is less than 3 months. And there is a previous venous thromboembolism. There is previous venous thromboembolism. Thromboembolism. And there is infections and the inflammatory bowel diseases, autoimmune diseases such as the anti-phospholipid antibodies, that is the APLA. Next is the SLE. Then the heading of the inherited thrombophiliasis. So the inherited thrombophilias. So this includes the factor 5 lead-in mutation. So there is a factor 5 lead-in mutation, and there is deficiency of the antithrombin 3. So deficiency of the antithrombin. So antithrombin 3, as well as the deficiency of the protein C as well as S, protein S. Next we look at the hypercoagulable state. So hypercoagulable state. So under this there is the pregnancy and the postpartum period. There is pregnancy as well as the postpartum period. There is also the COPD, nephrotic syndrome. There is polycystic polycythemia vera, as well as presence of malignancy. Next we move on to the iatrogenic. So iatrogenic, it includes the OCPs and the hormone replacement therapies as the HRT. Next is the chemotherapeutic drugs, the CTDs, as well as the insertion of the central venous lines. So insertion of the central venous lines, so we call it the CVL. Then we have the varicose veins. There is presence of varicose veins, as well as the prolonged car or the air travel. So in terms of the prolonged car as well as the air travel. To learn and grow daily like this, please do subscribe.